Hi everyone, my name is Shakira Curry, and this is my final capstone project entitled Improving Patient Care by Employing Additional iStat handheld devices for Informatics 700, which is a capstone class at Mercer University. For my project, the I decided to do research on my current hospital, which under the Children's Healthcare of Atlanta umbrella, it is the Scottish Rite location, and it is one of the three locations. And I chose to do the research on this specific location just because I was familiar with the location and pretty much the ins and outs of the inner workings of the hospital, and because it's bigger than the smaller location, but not as big as our biggest location, just for um, time purposes or the time allotted to do the project. And the Scottish Rite location is a level 2 pediatric trauma center. It houses 304 beds between all of its care areas. It encompasses 5 general care areas, 3 intensive care units, an emergency department, and a rehabilitation unit. The 5 general areas focus on pulmonology, hematology, oncology, neurology, endocrinology, and general surgery. And there is a pediatric ICU, a neonatal ICU, and a technology dependent ICU. And within Scottish Rite, the two areas that this research will focus on will be the respiratory care area, which focuses on patients that suffer from any pulmonary illness, whether it be acute or chronic, and the hematology oncology area, which focuses on patients suffering from sickle cell disease or any type of cancers. So the concept of this project was not to implement a new system different than the one set in place for the iStat and the point of care testing, but to determine if the current practices on warehousing the iStat is currently are beneficial as is, or if adding more iStat devices to more areas will benefit the clinicians and, more importantly, the patients, and improve the clinical workflow flow to ensure an effective level of care. Point of care testing is done at the patient's bedside using a portable device. In this case, it will be the iStat. And these tests can be done in a timely fashion to cut down the time it takes to receive critical lab results. And the lab results are displayed on the screen in about 2 minutes. These results can also be directly uploaded into the patient's electronic medical record for later viewing by the clinician. And the test that will be focused on in my research will be blood gas analysis. And this test is used to determine the amount of oxygen and carbon dioxide in the body for determining whether a patient's lungs are functioning properly. And the important values of the blood gas analysis are blood pH, oxygen saturation, total carbon dioxide, bicarbonate, base excess, partial pressure of oxygen, and partial pressure of carbon dioxide. So for my research, the formal research question that will be focused on was will employing the iStat device in both the respiratory care area as well as the hematology oncology area for point of care testing lead to improved quality and efficiency of patient care. So, for my research, the null hypothesis was having an iStat in both the respiratory care area as well as the hematology oncology area will lead to improved quality and efficiency of patient care. And the alternate hypothesis that was that it would be more beneficial to house the iStat in one area versus the other. So the research design methodology, the first type of research method that was conducted was correlational research, and I used an archive-based research. So this is just taking previously collected data from the iStat point of care data collection system and analyzing that data and adding new data based on interviews that were done with the clinicians. And correlational data research was done on my data specifically because the research is not to find if one variable directly causes the other, but to find correlation between the two. So to find a correlation between housing ISTATs in all areas and the efficiency of patient care. And the advantage of using this type of research was to determine the strength between those two variables. The other type of research that was used was qualitative research, and it was observational. And this was done by conducting interviews with clinicians from each of the care areas that would be greatly affected by whichever outcome is of the research. And an advantage of doing interviews is that the interviewer is able to see the clinician's emotions and read their body language to determine the results. So I chose two literature reviews that I felt like best represented the research overall. So the first literature review was on the article, The Reliability of the ISTAT Clinical Portable Analyzer. And it's just discussing the reliability of the ISTAT handheld device compared to other methods of collecting point of care blood gas samples. And the results of this data concluded that the ISTAT was just as reliable in testing blood gas samples. And for the second literature review, I did an article called A Rise and Fall of ISTAT Point of Care Blood Gas Testing. And this article just describes how the ISTAT device was initially initiated in a hospital due to the significant need for point of care testing. However, after implementing the device, because there was no difference in the amount of usage before and after, it was later discontinued. So this literature review just goes to show that the ISTAT is a reliable device only if it's used as beneficially as possible. So this is an analysis and a diagram of the current system and the current practices at Scottish Rite. So the first diagram shows that when a blood gas is ordered, and this is for the hematology oncology floor, the blood gas is ordered and the order is received by the respiratory therapy department. And a lab technician goes to the hematology oncology patient to take that blood sample and send it down to the lab, and the sample is analyzed in the lab and the results are uploaded to the server. And the second option would be for the blood gas to be ordered and the order be received by the respiratory therapist, and they go to the respiratory care area, retrieve the ISTAT device, then go to the hematology oncology area, take the blood gas sample and run the blood gas sample on the ISTAT, and the results are uploaded to the server. So these are the two options for the hematology oncology area, because they don't currently have an ISTAT in their area, but the respiratory care area does have an ISTAT, so they already have the ISTAT readily available for them. So the informatics component of my research would be the ISTAT device. And according to the manufacturer's website, this is a device that provides clinicians with the information needed to rapidly make treatment decisions. And this rapid treatment or care decision making could potentially enhance the quality of patient care and improve the efficiency of the overall system. So the specific test that was focused on was blood gas analysis, and these tests are performed using the ISTAT handheld device and ISTAT test cartridges. So drops of blood are drawn from the patient and placed into whichever ISTAT cartridge that is needed, and then the cartridge is then placed into the ISTAT device. The patient's information is entered into the ISTAT device, and the test is run for a total of 2 minutes. The results can then be recorded and then uploaded into the patient's electronic medical state electronic medical record via the docking station. So when considering the informatics component, um, we have to look at the cost effectiveness of either keeping the workflow the way it is or implementing new iStat devices. And with implementing new iStat devices, you have to consider that each iStat device is about $11,000 each, and the iStat cartridges range from between $3 to $7.50 per cartridge. So for this research, the data that um, was collected using the point of care data collection tool that is in correlation with the iStat. So the point of care department has access to this. And once the iStat is placed on the docking station, the test results travel over the server and populate into the electronic medical record. And this holds the data for each area, the amount of tests that are done on the iStat, and the who does the test and the results of the test. The other form of data collection was interviews, and three clinicians from each area, both the respiratory care area and the hematology oncology area, were interviewed, and the questions centered around the current practice, how it affected their workflow, and how adding changes will affect their workflow, and also how each clinician had any suggestions for improvement. So this is just a screenshot of the Excel spreadsheet from the data collection tool. Of course, because of patient confidentiality, I couldn't do a screenshot of the actual tool, but this is a screenshot of an Excel spreadsheet of the data of all the tests that are done in a 3-month span. And this is also a screenshot of all the failed tests that are done in a 3-month span, and it's for each area. So the proposed solution for the research was that according to the data collected, the respiratory care area performs more blood gases and uses the iStat device more than the hematology oncology area in a 3-month span. They perform almost 9 times the amount of tests, the 9 times the amount of tests of the hematology oncology area. And as far as training goes, the respiratory care area houses more trained staff for the iStat device. So according to this data and based on this data, having the null hypothesis was rejected, which was having the iStat in both areas will lead to improvement of the quality and efficiency of patient care. The alternate hypothesis was accepted, which would be it would be more beneficial to house the iStat in the respiratory care area over the hematology oncology area, specifically because of the amount of usage and the level of patient safety by having trained users conduct the test and run the test versus those who haven't had any experience using the iStat device. So based on the data that was collected, the organization will be able to save money on hardware and software by only employing the iStat devices where they are used most. The organization will also be able to save time, reducing the amount of time new staff that have to be trained on the iStat device and how to obtain the blood gases for the iStat device. And lastly, they are able to continue to improve patient care and safety by only having those staff members that were fully trained and efficient in the iStat device and blood gas analysis, and reduce the amount of collection and device errors that may be experienced by staff members that are not as experienced in the area. So those clinicians on the respiratory care area have more experience, so there will be less errors by only allowing them to have the iStat in their area and then allowing trained users to go to the hematology oncology area to obtain the blood gases versus having to train those hematology oncology clinicians. And though this project only focused on these 2 areas, it can be expanded by focusing on all areas of the hospital. And I just want to give a last thank you to Children's Healthcare of Atlanta organization, the Point of Care Department, for helping with the project. And these are my references.